Hello and welcome to another episode on Health is Wealth, a program where we discuss health. My name is Fatima Rufai Musa and I remain your host. Like always, our topic for today will be on combating obesity and high blood pressure through fitness and dieting. And of course, I won't be doing this alone. With me are two coaches. That's one is a fitness enthusiast and the other is a coach, where they will be educating us more on the topic. Welcome to our program.
Thank you, Madam.
So I would love for you to do the honor of introducing yourselves.
Okay, let me start first. My name is Mubarak Ibrahim. I'm a medical doctor professionally and also a fitness and health enthusiast.
My name is Elason Kuchigi. I'm a fitness entrepreneur, a coach, and a farmer.
Okay, so I will start with you, Doc.
Okay.
So earlier on I said we'll be talking on high blood pressure and what's it called? Obesity. So I would love for you to give us a bit explanation on what high blood pressure is and what obesity is.
Okay, first of all, let me start with high blood pressure. Okay. High blood pressure is simply defined as a chronic medical disease which is characterized by a systole. I'm going to explain later what is systole and diastole. Systole of 140 or above and diastole of 90 or above. Usually systole is when the heart contracts, the pressure in the arteries when the heart contracts. That is maximum should be from 120 to 139. So whenever it's above 139, 140 and above, that's defined as hypertension. Okay. And also diastole is when the heart relaxes because the heart contracts and pumps blood. That's when the increase in the volume and the pressure is the systole, while during relaxation before the blood flows, that's called the diastole. Okay. So usually there is also what we call isolated systolic hypertension and also isolated diastolic hypertension. Isolated systolic hypertension is when the blood pressure is 140 and above, but the diastole is normal. Okay. That's below 90. And when it's isolated diastole, that's when we call that's when the blood pressure is 90 and above. That's when the diastole is above, but the systole is normal. Mm-hmm. So can I continue? There's also usually causes of hypertension, about 85 to 90% is idiopathic or unknown. Okay. There is no particular reason. Yes, then there is also 10% of causes which are usually secondary due to secondary diseases, maybe renal artery diseases, or in some cancers like cancers of the adrenal gland and other things like that. Okay.
You mentioned that there are no causes of this high blood pressure.
Yes.
Is it hereditary?
Yeah, usually it's hereditary, the unknown.
So we can say it's one of the...
Yes, so we can also say it's multifactorial. The risk factors are genetic and environmental. Okay. So genetic, that's when it's hereditary, you pass down to your offsprings. Okay. You have a particular gene that is associated with that. But you can prevent having hypertension by lifestyle changes and other things. Okay. So usually when we talk about environmental, we are talking about eating maybe high salt diets. Okay. And living a sedentary lifestyle. Mostly these are the most common causes of hypertension. Okay. So if you are already genetically predisposed and you live your life this way, then there's likely chance you are going to develop.
So you have to take precautions in order for you not to...
Yes.
So over to obesity.
So obesity is actually not a disease. Okay. Because you can be obese now and later you are normal weight, so we can't say it's a disease, it's a state. Okay. We call it a clinical state. So it's a clinical state of excess adiposity. Adiposity means excess subcutaneous fat. Mm-hmm. Because there are bodybuilders and everything that can be overweight based on the metrics we use. We usually use BMI, body mass index. Okay. So this BMI is categorized as underweight, normal weight, first degree obesity, second degree, and morbid obesity. Okay. So when we are talking about underweight, that's when the BMI is less than 18.5. The BMI is actually calculated by your weight and height. Okay. It's measured in kilogram over meter squared.
Okay. So if I get what you're saying, obesity, when someone has obesity, it doesn't mean that the person has to increase in size and all.
most people that have obesity have excess body fat.
Okay.
Yeah, so you can be overweight based on the metrics. Like maybe my BMI could be above 25, that's overweight. My BMI could be 26 or 27, but because maybe I'm muscular, you can't call me obese. So it's based on fat tissue. That's just the thing.
Okay.
Yes.
So over to you, our coach of course. So how does blood pressure relate to fitness?
Yeah, blood pressure relate to fitness and
Fitness and exercise, sorry.
yeah, fitness and exercise, or let me say exercise and dieting. Yeah, in most cases, it relates more to what you eat.
Okay.
Understand? Because what you eat really play a very, very vital role in all of this.
Okay.
Because if you're eating a very good diet, most at times you won't really have more problems, or you won't really have all health issues that relate to your blood pressure and all of these things. But then if you are eating all the wrong diet, when I say all the wrong diet, I mean if your food is more of sugar food and the salty food, now you are going to be exposing yourself to most of these diseases, and not just high blood pressure, including
Other
other diseases. Yeah, it's like you're creating a window in your body for other diseases to attract in, because you are now making your immunity more porous and more weaker. So in most cases you need to fix your diet, tweak your diet. Your diet work plays a very, very vital role in whatever it is that you're doing that has to do with your health and exercise. So exercise and diet are the main criteria that will determine whether if you're going to have high blood pressure or maybe have some other issues that has to relate with your health. But then if these things are on point, then you don't really have to worry about them.
Okay. So what is the contradiction for people with excessive weight and also have high blood pressure?
Let me understand your question very well. Contradiction in what essence? Like, what are you trying to?
What are the challenges they could face when someone has obesity and also has high blood pressure at the same time? So with fitness, how do they overcome that?
Okay. Actually, it's easy. When I say it's easy, there's a way we say it. Like, it's simple, but it's not easy. Understand? It's simple in the sense that the steps are very defined. What you're going to do are defined. You just need to work out, you just need to exercise, be consistent with your exercise, what you do, and then you work on your diet.
Okay.
These are still the two most important things. Then you get enough rest, because most of the times what is really triggering most of this problem is lack of rest, which is stress, understand, bad diet, and the lack of exercise, sedentary lifestyle. Just like the doc says, sedentary lifestyle is sedentary lifestyle is a huge problem in so many things. So if you can fix these three things, sedentary lifestyle, you replace by an active lifestyle, diet, you tweak your diet, fix your diet, start eating all the right food, ditch all the bad ones, and then you exercise.
So he talked about how people with high blood pressure they do exercise. So, and one of the things that are advised for people with high blood pressure not to do is to stress themselves. Don't you think like through exercise are they not stressing their body enough to trigger their
I like this point. Actually, what is going on is there's what we call cardiac output and systemic vascular resistance. This is how you actually define BP. Cardiac output is the volume of blood that is going out of the heart per minute. Usually it's 5 liters of blood per minute. So systemic vascular resistance it has to do with our vessels. So it's usually causes of hypertension can be either peripheral in our vessels or in the heart. So in cases of hypertension, blood flows to maybe to the kidney, to the brain, the coronary arteries, it flows to the heart. Any pump of blood, that's where it goes to our guts, liver, intestine, to our skin and our muscles. So the blood that flows to our muscles usually is 1 liter. That's 20% of the blood during exercise. So when you exercise, whether you are fit at rest, 1 liter of blood is being pumped to your muscle. That's at rest. So during exercise, there is increase in blood flow to your muscles and decrease of blood flow.
It's more than that 1 liter.
Yes, it's more than that 1 liter. There is decrease of blood flow in your gut and your kidney, while others remain the same. So during this exercise, there is a hormone that is released. First of all, the muscle will signal to the through what we call sympathetic nerve system. This is usually when you are at rest. It's parasympathetic. When you are maybe working out, you feel like your skin is wet, you are sweating, you are breathing heavily. All these are due to activation of your sympathetic nervous system. So through this system, the muscle signals to the arteries to dilate during exercise for more blood to flow. And this dilation usually occurs due to some hormones, namely nitric oxide is released, and also what do I call it? Nitric oxide and prostaglandins, along with adrenaline and noradrenaline.
So
I'm
you
sorry,
need
I'm
to
using
break
a lot of
down,
mental
break this
terms.
down,
Yeah,
because
because that's the only
we are all
way.
lost.
That's the only way I will take you closer to what I mean. These adrenaline and noradrenaline are actually stress hormones, and what they do is they constrict the vessels. So when there is constriction of the vessels, the blood pressure will increase. So during exercise, the blood pressure increases. While this nitric oxide, then after exercise, this adrenaline and noradrenaline, their effects or their function will diminish, while the function of nitric oxide and prostaglandins, which help in dilating the blood vessels, will increase. The more you exercise, the more this nitric oxide and prostaglandins are dilating your blood vessels. So the more your blood vessels are dilated, blood pressure is usually like increase in pressure through the vessels. While the vessels are small, they are not big enough to take that pressure. So the more you are exercising, the more your blood vessels are getting dilated. So that's how you will see there are some people that are not even on medication, some hypertensives, they are not even on medication due to constant exercise. Their blood pressure is dropping
so you can,
because of this dilation.
Survive it without taking
Exactly.
medication.
Without taking medication, it's very possible to survive hypertension.
How can dieting and fitness affect obesity in a good way?
I think it's a big solution. Like dieting and exercise is one of the biggest solution and the cheapest solution for obesity, because obesity is actually you being overweight. It's just simply being overweight. So when you're overweight, you want to exercise, and by exercising under a supervision, under a non-supervision, you're normally going to be created or put through a program that is going to help you shed down the weight. And this exercise is going to help you shed down the weight, while the diet you are going to be put on is going to help you maintain the weight that you are losing.
So for people with obesity, their body is already used to consuming a lot.
Yeah.
So when it comes to dieting, how do you handle people with such situations? Because they are already used to eating a lot, and now you are telling them to eat a small portion of food or eat salad or eat that. They are already used to taking a lot. How do they handle that?
Okay.
And cravings.
I think, if I'm not mistaken, I think from the way you are saying this, it seems like you're already one of them. Like you're one of those people that are addicted to something, or that are used to eating something, and now you are.
Never said so.
No, it's just obvious because the way you say it, you say it shows that okay, you're actually saying your own pinpoints. Anyways, they were something before they became what they are at the moment.
Sure.
Right. So what they were before is also what they can become at the moment. So if they used to be normal before, not addicted or not used to eating the way they want, then and they now become used to eating simply because they love eating, you know, and they allow themselves to become what they are now. So they can still reverse the same situation to who they used to be. And now, what they need to do is all what the coach is going to put them through, and through support. Most of the times, if you have a support like family support, or family support is for your spouse or from your younger ones or from your friends, and the coach support alone will not take you that far. And you yourself, if you have to be committed. You have to want to reverse your own situation. So if you don't really want to reverse your own situation, even no matter how much the coach push you, no matter how much your spouse pushes you or how positive she is, you're still not going to get it right. But then if you are committed and really want to, then the coach is going to push you, your spouse is going to push you, and you're also going to push yourself. And definitely is not a day journey. Understand? It's one step at a time. You push yourself one day at a time. You're removing one. If you're addicted to sugar, it's 1 teaspoon at a time. Maybe you reduce 1 teaspoon this week. Next week you cut out 1 teaspoon, like that. Before you know it, if it's cigarette you're addicted to, cigarettes, 1 stick per day or per week. Slowly, before you know it, no matter what, you definitely break that addiction with time.
Okay, so for the exercise, what do you have a specific exercise you give people with high blood pressure to do?
Yeah, there are different kind of exercises depending on your situation. Even people with high blood pressure, a person with high blood pressure might not simply mean he only has high blood pressure, because before we even take someone in, that person has to fill a form. That person we have to know the person's real health state before we know exactly what to give them. If your problem is just high blood pressure, because now if you look at it now, if you look at people now, this generation now, like both adults, young people, old people, high blood pressure is everywhere.
True. Unlike before.
You
see, for someone to have high blood pressure, he must be an elderly
person. You see, the prevalence of obesity now and high blood pressure is just everywhere. It's very, very high, and most of the time the cause is just what we eat. Isn't what we eat. If you look at the problem is on our food label. Just look at our food label. What are you going to see? Excess sugar.
Refined carbohydrates.
That's it. And excess sugar has so many names.
Okay, so what is the main food item that causes obesity, and people with high blood pressure, when they take it, it also deteriorates their situation?
We can't really put it that way, understand? But I think what you're trying to say is, what is one food that affects both
parties
negatively? And I'll simply tell you just one, which is excess sugar. And excess sugar is not just all of them. Excess sugar affects everybody. Even you now, if you subject yourself to taking excess sugar for just 1 month, your body weight is going to change drastically. And you don't have to, it doesn't have to be refined sugar like cubes into your food. No. It can be you taking cornflakes in the morning and milk. Every morning you're gulping cornflakes. Every afternoon you're taking and burger. You know, in the night you're taking tea with biscuit, deceiving yourself that you're taking crackers because crackers have less sugar and all of those things. No, they're all sugar.
So taking distance also late at night also, like, because at times they'll say you shouldn't eat late, you should eat early because it causes a lot of things.
Yeah, it's obvious now. Why will you wake up in the midnight like a winch and start eating? We just wake up in the midnight and just go to the fridge and open a juice and start drinking juice and pancake or something. Or in the midnight, because you have a soup, you just go and mix some more, you know, and start. It doesn't make sense.
It doesn't make sense.
It doesn't make sense. So
when you have like say patients with high blood pressure and they tell you they go through fitness and all, do you like advise them to like, is there a specific exercise you're like, don't do this because it might increase the rate of
this is just like I explained earlier. So chronic exercise will make your BP drops because of this dilation of the vessels.
So there are no side effects.
There are no side effects to exercise.
And can you also like for people with obesity and also people with high blood pressure, can they go through all that journey without taking antibiotics?
Exactly. And just like you know, initially, first of all, the exercise have to be graded. It's like coach can explain better. So for someone that is obese, let's say first degree obesity, his BMI is 30 something. Above 30, that's obesity. So let's say his BMI is 30 something, at least what he can do, he is going to be naturally more physically fit than someone with maybe morbid obesity that have BMI of 40. So for someone with maybe BMI of 40, for example, you can start by just simple walking. Just walk every day, maybe 20-30 minutes every day for a start. Then gradually, as your weight is dropping, as your body is getting, because the more you exercise, the more you get used to it. The muscles and nerves fire together and it gets easier. So the more you exercise, the more you get used to it. So you can advise them to start maybe just by walking. For example, if they are too overweight, even overweight with hypertension or diabetes. You know, one thing about obesity, it goes hand in hand with hypertension, diabetes, and high cholesterol. When you have this, there are different types of obesity. We have the abdominal type, which is more common in men. And we have the pear-shaped type, which is more common in women from the buttocks downstairs. So the one that is at higher risk of developing diseases, is usually the visceral obesity. And you measure that by knowing your waist circumference. That's just how it is. For men, there's a way their waist circumference should be, and for women too, there's a certain value that it shouldn't be more than that. If it's more than that, then you're at risk of all these diseases: hypertension, diabetes, and high cholesterol. So you can advise them, even when they are not diabetic, if they are like obese, you can advise them already to start taking low sugar diets, low salt diet, and exercising. Just let them make it a habit to walk every day. So, and gradually you increase intensity of the exercise. You do more cardio exercises that requires you to maybe, we call it aerobic exercises that requires more oxygen. These are the type of exercises that burn calories more than anything. Not just maybe lifting weights or just this thing. You need to do intense workout, from walking to maybe jogging and to maybe doing more intense exercises like burpees and all these other things. My coach can explain further. So that's just how you advise them gradually exercise and diets, then they can tackle their problem. Not everyone needs medication actually. But they prefer taking medication every time
because it's easier.
So when someone goes through the journey of dieting and fitness, is there a certain stage that he has to stop it, or is it continuously he has to do it?
Fitness is a cult, the way we always say. Fitness is a cult, it's a good cult. Why is a cult? Why you call it a cult is because once you are initiated, you are initiated for life. And the good thing about it is that you can't start fitness and stop. Because when you start, at first, it's like a hobby to you, right? Then next is become like a passion. Then you become obsessed with it. And once you become obsessed, then the next is it becomes your lifestyle.
How do you do with the consistency? The
consistency comes and go. You know, you can't really pride yourself of being very consistent. You can't be consistent. As I always say, you can't be consistent, but you can't be disciplined. Understand? Because there are days that you don't feel like working out. There are days that it's just like your job. There are days that you don't feel like coming, but because if you don't come, you won't get paid. So you have to come.
We need that.
Yeah. So what is holding you down is not consistency now, it's discipline. Because you are simply disciplined, you know that you have to get paid. And what is discipline? Discipline is simply doing what you have to do, even when you don't feel like doing it. So you see now, that's how fitness is. Some days you don't feel like working out, you don't feel like eating right, you feel like eating a burger and some days. But then you feel like, come on, if I eat this today, man, it may be a problem. But that's the reason why sometimes you just go off like, okay, man, let me satisfy my craving. I've tried. I've gone like 6 weeks without eating rubbish. Understand? Like there is this sugar challenge you are on now, right now. I know you are part of this sugar challenge. So possibly at the end of the sugar challenge, because a lot of people have been going on without sugar. This is the 15th day without any sugar. So now possibly now at the end of the sugar challenge, now you decide that, okay, I want to treat myself to a good sugar diet. Maybe I want to get a pancake. Since it's been long. Despite there are some people that they are just pretending to be on the challenge, but they are really not on the challenge. They've been taking their diet coke every day. But then, yeah, these are some of the things. So you can't really be consistent all the time, but you can be disciplined. If you develop the habit of discipline, then you really go far in fitness, and you really go far with all your goals, not just fitness, but other things too.
Okay, in situations where someone is he's in the system of the dieting and fitness at the same time, he eats well, he does the workout, but the weight doesn't reduce. So what do they do at that particular moment where they watch their weight, they watch what they eat, they do the exercise and all, but it doesn't reduce?
Have you ever heard of doing the same thing and doing the same thing? There's a saying that says, if you're doing the same thing and getting the same answer, if you're doing it continuously, what does that mean? They said it's insanity, right? It becomes insanity. So how can you be doing the same thing? Can you be doing all the right things but not getting the right results? That means there is something you are not doing right.
Or it doesn't work for you.
No, it works for everybody if you are doing the right thing.
Okay, so somewhere.
Yeah, maybe you are not doing the right thing. Maybe what you think the food, maybe there are food that you think is the right food, maybe they are not the right food for you. Okay. Or maybe the exercise you think is the right exercise is not the right exercise for you. See, there are some things that you're doing. So as long as you are consistent with it, even if you don't get the right answer, you are going to get the wrong answers. Like by doing the wrong things, you can even get the wrong answer. There has to be an answer. There has to be a result. Understand? So that's where you check yourself and see where you are going, what you are doing wrong, and where you are heading to. Most of the times, there is the difference between hitting a plateau and totally not getting the results. Like in our own journey, we hit plateaus here and there. Understand? The easier, there are sometimes that they hit a plateau and they be like, coach, this thing is not going well for me. It's been days or it's been weeks, I've not been getting this, I've not been getting that. Okay, then we sit down, we go through what you're doing. We go through what you're doing and see, okay, what is it that you're not doing right? Understand? Then from there, we definitely pick out the problem and then we fix it.
Okay, so what are the things that people should avoid? People when they find themselves in such situations, what are the things
people that are obese or hypertension,
people
both of them?
Both parties.
So first of all, just like we spoke about diets, okay. Diet is actually the most important and the most difficult part of fitness journey. Mm-hmm. Whether you are trying to gain weight by building muscle or you are trying to lose weight, mm-hmm. Diet is the most difficult part and the most important part. Because just like you asked coach, what about those that are exercising but they are not noticing any weight loss? It could be their diet. So as long as you do this exercise, how it is done, first of all, hypertension is more associated with high salt diet. Mm-hmm. While the obesity, you could be obese and have hypertension and diabetes. So if you are diabetic, you have to avoid high sugar diet. Mm-hmm. Salt and sugar are actually the enemies here. So you just have to limit. You can advise them on eating more vegetables, okay. More fruits, eating, if you have to eat carbohydrate, then maybe fiber. Mm-hmm. Among the carbohydrate is the most suitable type of carbohydrate for diabetics. Mm-hmm. because fiber helps in decreasing insulin resistance. I know you have heard about insulin before. So insulin is the hormone that is produced by the pancreas, which helps in taking our blood glucose, taking glucose from the blood and utilizing them in the cell. So those that have type 2 diabetes, because we have type 1 and type 2, type 1 is usually unavoidable. It's genetic and you can just inherit it directly without, even if you have the best diet. While type 2 is the type of diabetes that can be avoided by lifestyle changes, dietary modification and all that. So those that have type 2 usually have this insulin resistance. The insulin is there. Type 1 depend on insulin injection. But type 2, they have this insulin resistance. It's there, but it doesn't utilize our glucose well into the cells because of this resistance. So among carbohydrates, fiber is very good in improving or decreasing the insulin resistance. So other things could be like eating more protein and usually fruits, vegetables. That's what you have to advise them on. They have to limit all these refined carbohydrates, even the salts. They have to limit it, and use of white Maggi. Yeah, this is very important. We always say this to people who have hypertension. They will tell you, doctor, I'm not using salt in my diet, but their BP is always high, and they are even trekking, they are walking every day. When you ask them, and they'll tell you, yeah, they use white Maggi a lot. White Maggi is just like our body treats brown sugar sometimes as white sugar. That's how our body treats all this white Maggi as salt sometimes. So usually less salt diet and low carb diet. That's what you have to advise them on. That's just what they'll do.
So word of advice from you, coach?
Yeah, I will just add a little bit to what he said, because what he said is very delicate in terms of high blood pressure and obesity. The diet is the most important thing in whatever we are doing. Generally, the diet is very, very important, and most of the times people mistake the kind of diet they are supposed to be on when they have problems like this, because people don't even know what is carbohydrate in the sense, because there is difference between complex carbohydrate and simple carbohydrate. So what people are not supposed to be taking is the simple carbohydrate, and what people need to moderate is the complex carbohydrate, and what people need to take more of is the protein. Animal protein is king wherever you are. Plant protein are good, but animal protein are king. You need to feed on those animal protein. I'm a living proof because I've been a vegan for 7 years, so I know what I'm saying when I say animal protein are king. So then you need to understand that. Anyway, maybe in another program, but people need that understanding on the kind of food we eat these days, most especially fruits. People think fruits are lifesavers. Fruits are no longer lifesavers. That's just the facts. Some people may not take this lightly, but fruits are no longer lifesavers, and people are really thinking that salts are always the culprits, but salts are not the culprits. Salts are mostly innocent bystanders, and the main victim here is sugar, excessive sugar. Excessive sugar, and when I say sugar, I mean soda, everything that has to do with sugar, everything refined carbohydrate, bread, juice, smoothies, all those things. People think they are good.
Smoothies, there are a lot of people that take smoothie as a form of dieting.
Anybody that takes smoothie as dieting, when I say smoothie, I mean sugary fruits. When you juice with sugary fruits, don't get me wrong. Some people will quote me wrong now and say, okay, you are taking tomato juice now, tomato smoothie now, and they think maybe, okay, I say no. When I say smoothie, I mean sugary. When you juice your sugary fruits, those things are very they catapult. They don't just spike. They catapult your insulin. Yeah, some even add sugar to it. Imagine you going to buy smoothie and they will add sugar to the ice cube. Imagine. All these things are some of the things that are causing problems in our life without us even knowing. So if we can really boycott some of these things and understand that, okay, these things are the problems, and what we think are the problems are not really the problems, then we will start living a healthy life. We just need to get the people aware that fruits are not the way they used to be anymore. Wheats are not the way they used to be anymore. Semovita are not the way they used to be anymore. So don't think the semovita our forefather took or our grandfather took or the wheats they took are the same as the one you're taking today. They are not the same. They are totally different. So you need to understand that your generation has changed. Everything is now genetically modified. Everything, including humans. Imagine. Thank you so much.
Which brings us to the end of today's episode. If you are having this sickness at the moment, please, you should try engaging yourself in the gym and schedule yourself on a diet and to reduce the amount of sugary things we have in our body. My name is Fatima Rufai Musa and I remain your host. Keep watching BUK TV.